Yesterday, I reviewed recommendations for the public, and today I turn to recommendations for state and federal leaders and for the health personnel that we all depend on. I joined 17 other concerned, experienced healthcare professionals to draft our collective advice to stay safe. We published our recommendations this week in USA Today, and I want to share them with you by video to try to reach as many people as we possibly can. This is not a single voice on social media, but this is the message of 18 of us together, all agreeing with each point for what we should do at this point in time. All that follow are the exact words in our opinion piece in USA Today. And so let me go back to the words of advice in the article that we wrote, specifically for state leaders. And this goes to both state and local leaders, community leaders. And these are the words. Prioritize the most vulnerable in your community, the elderly, the sick, and those living in close quarters. Temporarily close bars and restaurants when there is evidence of rising community transmission. Work with Congress to provide continued economic support for your constituents most urgently affected by the pandemic's financial blow. Consider temporary suspension of commercial air and rail travel. Ensure the safety and resources needed for your healthcare workforce. Healthcare and critical infrastructure workers should have the highest priority for personal protective equipment. Make rapid expansion of COVID-19 testing a top priority. Open drive-through testing stations and at-home care. Make prescription drug supply and other necessities in your community a priority. Provide immediate training for all medical providers to join the effort wherever they can be most useful. Honor cross-state medical licensing for all healthcare providers until the pandemic is over. Prepare large spaces to become quarantine residences as needed. Coordinate with the National Guard to provide surge ICU capacity for communities in need. Create fever clinics for triage. Reevaluate any regulations that impede any of the above or the below. And finally, to healthcare workers specifically, we know you are in uncharted waters and are standing on the front lines. All of us depend on your training, your compassion, your commitment, and your untapped capacity. If you've not yet joined this fight, please reach out to your local hospital and find out how you can enlist. Contact telemedicine platforms and offer your services. Stop all elective surgical and medical procedures now. Send people home if it's safest for them to be at home. Reinforce the benefit of staying home and getting tested. Help the people on the front lines do their jobs. Focused and united, we can avoid the worst possibilities. It's up to all of us. As a country, we can overcome this together. And that's the end of the article, but remember, this advice is from 18 of us together, including the former Surgeon General, the former head of Medicare and Medicaid, the former U.S. Senate Majority Leader, public health specialists and former commissioners, a former White House physician, Dean of the Harvard School of Public Health.